Hello, everybody. This is Dr. Laird Bridgman. I'm your friendly neighborhood psychologist here for a short video today. And I want to talk to you about how to select a therapist. I particularly want to tell you what not to do, and then I'll talk about some things that you can do to increase the chances that you can select somebody that has a more likelihood of being a good match for you than not. So the single biggest mistake that people make when selecting a therapist is that they tend to look for other people's opinions. So reviews like on Yelp or Psychology Today or whatever, ratemytherapist.com. Is that a thing? I don't know. So they look for other people's opinions. Trust me, other people's opinions are not necessarily going to be good for you. You need your own opinion. Secondly, they look at credentials. Now, certainly credentials are important. I'm not saying not to consider those things. You should, but they're not the main thing. It's not enough to make the decision on those factors alone. If you look at the research on what is the single best predictor of successful therapy, it's the quality of the match between the patient and the therapist. Okay? So you need to trust your instincts. So you need to actually go one step beyond credentials and online reviews. You need to have a conversation. So hopefully most therapists will provide a short phone or Zoom consultation of like 10 minutes, 15 minutes, where on the one hand, they get a feel for what kind of things you need help with, and to make sure that's within their sphere of expertise. And on the other hand, that you can get a chance to talk with them and make a decision about how well the connection is for you. And that's what you're really looking for, right? Is how's the vibe? Do you feel safe? Do you feel comfortable with this person? And that's got to be really quick. So if you don't pick up on safe and comfortable really quickly, you should probably keep looking. But besides that question of can you do a brief conversation with me, I think the thing that you want to really ask them about is like, what are regular therapy sessions like with you? Like if we were working together, what's an average session going to be like? And then is it going to be structured? Is it going to be not structured? Do you have to bring the agenda? Do they work together with you collaboratively? Or is it just kind of whatever you want to talk about today is what we'll talk about? And then you need to know what you want out of the therapy. So if you can kind of put those two things together, you can feel the vibe of the session and you can make a decision about like this person feels right to me, then you have a good chance of having a good outcome. Okay, listen, that's it. Thank you so much for tuning in today. I really appreciate it if you watched to this point in the video. I will wish you a good day today, and I will look forward, hopefully, to seeing you again.